Has jaw pain become the newest weight loss plan? Forget GLP-1s. If it hurts every time you chew, you'll be eating less. Maybe every morning your jaw feels stiff. Maybe you can't even open your mouth all the way without pain. And if you're sitting in a quiet room, you don't even need speakers anymore. Your jaw provides all the sound effects. If that's you, there's a good chance you've been told you have TMJ, or more accurately, TMJ dysfunction. You go to your dentist, they get you the night guard, they adjust your bite, and it helps, but it still hurts. And if they resolve it, great. But unfortunately, that doesn't always happen. You stop chewing gum. You order soup when everyone else gets a steak. You start cutting your sandwich into tiny little pieces. Maybe even you've had injections. But what if your jaw isn't the only source of the pain? What if your neck is quietly changing the way your jaw moves every single day? Now hold on, I'm sure there's a few of you watching this video who already think this is bull feathers. So bear with me for 20 seconds and you can see for yourself. Tap your teeth together and pay attention to where they contact. Now look up and do it again. Now look down and do it again. Now shift your head to the right and do it again. Now shift your head to the left and do it again. See how that changes where your teeth contact? Does this mean that everyone has a neck problem causing their TMJD? No, but it does show how your neck can affect your jaw position. Let's talk about why and how this can play a role with your TMJD. I'm Dr. Paul Fisher with Innovative Nerve and Joint Centers. I'm a doctor of chiropractic and one of the few chiropractors nationally with advanced certification in chiropractic biophysics, or CBP. When I say structural alignment, I'm not talking about whether your neck feels tight today. I'm talking about whether the actual shape of your neck, the curve that's supposed to be there, has changed over time. That's what chiropractic biophysics measures and rehabilitates. We don't just ask, does it move? We ask, is it in the right position to function well for the next 20 years? CBP is a specialty that focuses on measuring and correcting abnormal spinal alignment using objective x-rays, posture analysis, and structural rehabilitation, not just making joints move better. Over the years, we've helped hundreds of patients improve their posture, restore healthier neck alignment, and reduce pain by addressing the underlying mechanics instead of simply chasing symptoms. I'm going to show you why abnormal neck alignment is one of the most overlooked contributors to TMJ dysfunction, why simply treating the jaw isn't always enough, and why working together with your dentist often provides the best long-term outcome. First, let's clear up one common misunderstanding. Everyone has a TMJ. Well, two of them, actually. TMJ stands for temporomandibular joint. It's the hinge connecting your lower jaw to your skull. The problem isn't having a TMJ. The problem is when it isn't functioning properly. That's called TMJ dysfunction, or TMJD. Every day you use this joint hundreds, if not thousands of times, from talking to eating to swallowing. So when something is even slightly off mechanically, you notice it quickly. People began experiencing clicking or popping, jaw pain, difficulty chewing, headaches, ear pain, facial tension, neck pain. Notice that last one? Neck pain. That's not a coincidence. One of the biggest mistakes people make is thinking the jaw works independently. It doesn't. Your jaw is attached to your skull. Your skull sits on the top bone in your neck. Your neck supports your head all day long. Think of the jaw like the front door of your house. If your entire foundation shifts, the door suddenly doesn't open and close quite right. Is the door broken? No. The frame changed. That's exactly what can happen with your jaw. If your neck loses its normal alignment, your head begins sitting further forward or to the side. The muscles that control your jaw begin pulling differently. The joint experiences abnormal pressure. Over time, clicking becomes pain. Pain becomes inflammation. Inflammation becomes difficulty chewing. Now, let's talk about why we're seeing so much more TMJD today. It could be from a previous trauma like a car crash or a fall, but look around. We're all doing this. Phones, computers, tablets, laptops, hours every day with their heads drifting further and further forward. Your head weighs about 10 to 12 pounds. But if it moves forward, the stress on your neck increases dramatically. Think of it like holding a bowling ball. Right here it's okay, but the further out it goes, the heavier it gets. Now those muscles supporting your head are working overtime. The muscles attached to your jaw begin compensating. It's kind of like having one employee at work doing everyone else's job. Eventually, they get tired, they get irritated, they start complaining. Your jaw muscles do exactly the same thing. Now, before any dentists watching this start typing me an email or a strongly worded comment, let me be very clear. Dentists are incredibly important when treating TMJ dysfunction. If you're grinding your teeth, clenching, or your bite needs attention, that's absolutely something your dentist should evaluate. 9 guards protect the teeth. Dental treatment improves how the teeth come together. But here's the important part. If abnormal neck alignment continues placing stress on the jaw, you may still have symptoms. That's why the best care often isn't choosing between your dentist and your chiropractor, it's having them work together. At INJC, our role is to determine whether your neck is contributing to your jaw problem. And we're not just guessing. We perform a structural evaluation based on evidence-based chiropractic biophysics principle. That means we evaluate your posture, your head position, how your neck is aligned, how your jaw moves, and when appropriate, we use precise x-rays to actually measure the curves and alignment of your cervical spine. Why is that important? Because research has shown that losing the normal curve in your neck or developing forward head posture changes how the muscles and joints throughout the head and neck function. If your foundation is off, everything on top of it has to compensate, including your TMJ. That's why we don't just ask, where does it hurt? We look into why. Many problems, pain in one area is caused by problems in another. When we identify those structural problems, we combine pain relief therapy with rehabilitation exercises and CBP-based structural correction to improve how your neck supports your head and how your jaw functions over time. If we find abnormal cervical alignment, or our goal is to improve how your entire head and neck function together. Depending on your condition, treatment may include gentle pain relief therapies, soft tissue treatment, targeted rehabilitation exercises, postural correction, and structural chiropractic care designed to restore normal neck alignment. Notice, I didn't say we treat the jaw. We treat the structures influencing how the jaw functions. When those mechanics improve, many patients notice less pain, less clicking, improved chewing, fewer headaches, less neck tension, and better overall function. One thing we're especially proud of is working alongside dentists. Your dentist understands your bite, your teeth, your oral health. We focus on posture and alignment, the cervical spine, joint biomechanics, muscle balance, and nervous system function. Instead of asking, is this a dental problem or is this a neck problem, we ask, what role is each one playing? That gives patients a much more complete solution. So if you've been living with jaw pain, if your jaw pops every time you eat, if you're tired of avoiding certain foods, or if your TMJ symptoms are accompanied by headaches and neck pain, it may be time to evaluate more than just the jaw. At INJC, we work together with your dentist to relieve pain, improve neck alignment, and help restore more normal jaw function. Because our goal isn't simply helping you chew without pain today, it's helping you enjoy life without constantly thinking about your jaw tomorrow. One of the questions we ask every TMJ patient is simple. Why is the jaw under stress in the first place? If the answer is structural imbalance in the neck, that's where our expertise comes in. Many patients have both. That's why collaboration often produces the best results. If you'd like to find out whether your neck is contributing to your TMJ symptoms, give our office a call and schedule a consultation. If you found this video helpful, please like it, subscribe to our channel, and share it with someone who can't enjoy a steak without their jaw sounding like a bowl of Rice Krispies. If you have any comments, please leave them below. I read and respond to them all. Thank you for watching and wish you the best.